Peace be to all. Assalamu alaikum. Omar here, doing a semi-long run. All right, so today I want to talk about regrets and how they can actually encourage or inspire you to live in the moment to the best of your ability, and also plan for your future, however long it may be. So I'll introduce myself for those of you guys that don't know me. I've been on YouTube for, I guess, almost going on 9 years now. I have a doctorate of health education. I'm a health educator and a medical provider as a physician associate and a biologist. That's my first degree. So I'm also a middle-aged, moderately fit distance runner. So that's something that I've been doing for a long time that keeps me, I would say, balanced. So as far as regret is concerned, I was talking to some younger people about medical school versus PA school. And one of the things I do is mentor pre-med students and pre-PA students and pre-NP students. So, they can get a feel of what it is they really think they want to do and what it's like to, treat patients and think clinically. So that entails a lot of things. And one of the things we do is we listen to older patients. By older, I mean 50 and older. That's me. And a lot of them talk about the regrets that they have. They wish, if they known they were going to live as long as they are now, they would have taken better care of themselves when they were younger. But God only knows how long you're going to live. I just turned 55 a couple of weeks ago. So for me, my next big milestone is 60. If I make that, Lord willing, inshallah. So I'll be a bona fide senior citizen guy. But I have regrets. There's things that I've done to even sabotage my own success, just out of ignorance, indolence, and ineptitude. And it's you can't do anything about the past, but I can try to be the best version of myself in the present, and then also plan for that future. So my patients that have got things like COPD and have had heart attacks and strokes, they're like, well, what can you give me for this cough? And I'm like, well, are you still smoking? Well, yeah, what's that got to do with it? Well, I mean, that's part of your problem, So they've been smoking. They'll tell me, we do something called a pack year assessment. So maybe it's somebody in my age group and they have a 40 pack year history. So they've been smoking a pack of cigarettes a day since they were teenagers. So, well, you gotta stop smoking or cut back. And I work with them on doing that. Wow. And then if they have, I've treated folks for, who've got liver disease from alcoholism. They've really messed their bodies up. So I said, well, okay, you're drinking a pack of beer a day, and throwing a couple of wine coolers or two, and you're saying that you're not an alcoholic and you've been doing this for years. But then you down the keg and your liver function enzymes are all over the place. You got jaundice and you want me to fix you. Well, you got to start, and you can. A lot of the diseases that I treat are reversible, but they're due to years and years of neglect and abuse that a person heaps upon their body. But they can fix it, and it takes a step or a small step. Hey, and it's not easy. It's easier said than done. A lot of books and a lot of these motivational speakers will be like, hey, all you gotta do is do it. Well, not everybody's wired like that. You know, so you do the best you can where you are. One person quit. I'm happy to say they stopped smoking cigarettes because I said, all right, just try smoking one less cigarette per week until you get down to not smoking any cigarettes. And of course, you can use stuff like pharmaceuticals, Nicorette gum, and that kind of thing. But you know, it's a step. I had a patient who was a very heavy crack user, and she was in a program, and they would give the person a keychain, like for every 2 weeks, you got a keychain for every 2 weeks that you hadn't used crack, and your urine was negative for drugs. She came to the clinic where I worked at the time with this keychain. I think it was 12 weeks, which for her was a monumental achievement. She said, Dr. Lee, look, I got my keychain for 12 weeks. Aren't you proud of me? I said, yes, I'm very proud of you. And, you know, sometimes she would relapse. I'd worked with her over years, but that's going to happen. Sometimes, even though you've got regrets and you try to overcome a lot of the mess that you may have made in your life, you may relapse. But don't beat yourself up. You just pick yourself up and try to recover and keep going forward. All right, guys, that's it for now. If you want to be a PA like me or have an interest in health education, feel free to reach out to me. I'll leave my contact information in the description. I wish you guys the best of success in your positive endeavors. Peace.